What would you recommend for these under eye bags? Are fillers worth the risk? I have deep bags and dark circles, even though I rarely drink alcohol and sleep a sound 8 to 9 hours a night. I'm ready to look awake again. What should I do?
Thank you for your question. You've submitted several photos and you state in your question what you're asking what to do about these under eye bags. You also mentioned dark circles and you're asking are fillers worth the risk? Well, certainly I can assist you with this question. I'm a board certified cosmetic surgeon and a fellowship trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people address under eye bags and dark circles has been a major part of my practice during this time. And certainly a lot has evolved over the many years that I've been in practice. So, with the absence of a physical exam, however, I can certainly give you some recommendations as how I approach someone like yourself based on your photos alone. So the first thing I found interesting was the question about fillers. So clearly enough people are exploring use of fillers to try to blend under eye bags, which is one of the reasons why we're so busy helping people deal with the misadventures of under eye fillers. You see, in order to understand what to do for the under eye bags and dark circles, we have to define what the anatomy is and then what the options are. So to begin with, the first thing is what is causing the puffiness under your eyes? Well, what's causing the puffiness is called lower eyelid fat prolapse. This means that fat from around the eyes has pushed forward and created these bags. Now, more than a few years ago, an article came out where a hyaluronic acid filler could be used to help blend the appearance of mild under eye bags. Well, move the clock forward and people who, especially non-surgeons, are trying their best to try to hide under eye bags by adding tremendous volume from around the eyes. And so in our practice we get to use hyaluronidase or basically an enzyme to dissolve these hyaluronic acid fillers. You know, there is a role, and I do this in my practice, where I can help blend mild under eye bags. So from my perspective, when you're dealing with fat pockets that have pushed forward beyond a certain level, you want to treat them more definitively. So typically for someone like yourself, we would perform a procedure called a transconjunctival blepharoplasty. Now this is a procedure which is a local anesthetic procedure with light sedation where I address the fat pockets from behind the eyelid, from the inside. Now many people think that fillers and surgeries are very different because fillers are considered less invasive. I would actually argue the contrary. But once you place a needle through the skin and you're putting a material, that's an invasive procedure. But ultimately the goal is to get best results possible and long-term benefit. In addition, I often routinely, for the skin quality improvement, I'll do a combination of the use of platelet-rich plasma and the use of fractional CO2 laser. Now, platelet-rich plasma is derived from your own blood, and it's a concentration of the wound healing and growth factors in the blood that helps you heal after a cut. So what we're doing is we're stimulating your body to form collagen and improve the skin quality. We use a fractional CO2 laser to help improve skin quality by reducing the wrinkles in the top of the layers of skin and tightening up the skin. This is a very, very good combination. Now, it doesn't mean fillers don't have a role, but I'd like you to take a step back away from just the eyes alone. It's very important to understand that the cheeks actually have a very important role in the way the eyes appear on the face. And in many ways, the cheeks actually frame the face. So we'll actually place volume in a very special method at the deeper level called structural volumizing to help restore volume in the cheek area, and the combination can be very, very effective. As you can tell, this is an art. And if you go to 10 doctors, you will probably get 10 different ideas. And sometimes it takes a little trial and error. But as far as from my perspective, I think the suggestion that I made would be typical for what I would recommend to someone who comes into our practice. Are there times when patients will ask me to try filler first? Of course. And at least we make an informed decision together about what the benefits could be and what the limits are. Sometimes people don't have time for surgery and they'll actually do the filler as a way to buy some time before they do the procedure. So learn about the options by meeting with qualified, experienced specialists and find someone you're comfortable with. It's very important that you meet with someone who spends time with you, who explains all these things, and once you're comfortable, move forward with the plan. So I hope that was helpful. I wish you the best of luck, and thank you for your question.